Hi guys, we've been asked to develop a video to show you to increase the range of movement of the hip. So Des is going to just show us a sequence. So here we've got hip abduction. So with abduction we're using the glute medius, glute minimus and the tensor fascia lata muscles. By doing this we're increasing that range of movement of external rotation of the hip, which is about 50 degrees, but by doing these mobility exercises it can increase. Here we've got lateral flexion of the lower back, and we've also got internal and external rotation of the hips. Lateral or internal rotation is normally 40 degrees, medial or external rotation is 50 degrees, and also the muscles involved in internal rotation involve the glute medius and minimus and the tensor fascia latae. Here again we're using lateral flexion of the lower back, but also some internal and external rotation of the hip, and also some flexion of the knee and some plantar flexion movements of the ankle. Here we're doing a movement that involves flexion of the hip, but also involves extension of the hip, which is the glute maximus and the hamstrings. So they're getting mobilized. And here we're doing an exercise which involves abduction, again glute medius and TFL, but also increasing that range of movement around the acetabular femoral joint and also the pubic symphysis, which is a common injury in football, which is very painful. Again, on a prone position, we're getting the lateral flexion right and left of the lower back. We've also got internal and external rotation of the hips and also a slight medial and lateral rotation of the knee. Next exercise, we're looking at flexion extension of the lower spine, but also flexion extension of the hip. Extension of the hip involves about 30 degrees of movement, and flexion with straight leg 90 degrees, flexion with bent leg 120 degrees. And we finish off with a classic hip flexor, which stretches the iliopsoas muscle and the pectineus, which are deep into the hip groin area. Thank you, Des. Hi, John Rothery, Osteopath. Today I'm going to show you a hip assessment. We've seen some hip mobility exercises done as part of a warm-up for football, but this is how we'd assess a hip. So from the bottom of the table, what you can do is just turn the feet inwards, which is internal rotation, and external rotation. With external rotation, you're looking at mainly the piriformis muscle, and with internal rotation, we're looking at glute medius, minimus and TFL. Flexion, what we can do is hold the limb. We're looking at about 120 degrees into flexion, so we're looking at the main muscles of flexion will be the iliopsoas and rectoris femoris. From here, we can do internal rotation, so the head of the femur is still, and external rotation, so that's internal rotation and external rotation. External rotation, again, piriformis, internal rotation, glute medius and TFL, tensor fascia lata. We can test from there, we can do abduction. So again, we're looking at glute medius, and then this also gives a test of how tight the adductors are. Adduction, so we lift the leg up into adduction. Again, the muscles for adduction, we're looking at adductor brevis, longus, and tertius. These are kind of assessments. What you do find as a footballer, you might find that they have a tear in the acetabulum. So one of the tests we do, so if as a footballer and you kick the ball quite aggressively, you can tear the acetabulum. We do a grind test. So literally what we do is we push down and we grind and look for pain within the acetabulum. They're kind of common injuries to the hip area. Classic hip extension exercise, which we've not assessed, if you just lie on this side, Des. To assess the hip, again we rest this leg on our knee, make sure it doesn't drop into internal rotation, and all we do there is take the leg back, and again that's testing the hamstrings and the glute maximus. So the hamstrings, you've got semimembranosus and semitendinosus. Just lie on your back again, Des. A good way to assess the hamstrings is to take the leg up into the air and find the position of bind. If we're going to assess they've got different types of hamstrings. You've got this group here on the inside, you've got semimembranosus, semitendinosus, and bicep femoris on the outside, which inserts into the fibula head here. To test it, to test the bicep femoris of the hamstring, we internally rotate and adduct, and we see if there's any pain or any tightness. And again, to assess the the semimembranosus and tendinosus of the hamstrings here, we external rotate and again, take the leg out to the side. We can turn this into a stretch, which we'll show on the next video. That's the hip examination. Thank you.